everyone, this is Brittany and this is my presentation for my interview and observation paper. So the purpose of my paper was to evaluate an individual and give suggestions to better their quality of life as if I was a real therapist. The woman I interviewed was a 75-year-old and her interests include family, friends, church, card games, and TV. Some problem areas I noticed and that we discussed was that she was overweight, diabetic, limited mobility, and she had arthritis. And I would just like to state that I received permission to use her photos. Okay, so for almost all her ADLs, she was independent. That means she can shower, bathe, toilet, all of that. She can do it independently. But for her instrumental activities, about 50% of them she was independent and about 50% she needed assistance. She was independent in meal prep and safe environment, but some of the stuff she needed assistance on was shopping, driving, and health management. Her husband does take her to the grocery store and he does drive her wherever she needs to go. Just because she's anxious about it, doesn't like it. Sleep and rest, she said it was about average. She rated it a 6 out of 10. And sometimes she wakes up in the middle of the night, has to use the bathroom, or her arthritis pain flares up. She has to take medicine before she can fall back asleep. Her work, she's a retired hairdresser. Her leisure, like I said, she likes to watch Good Morning America, play card games, especially euchre. In her social participation, she counsels newlyweds at the church with her husband, and she's a member at the senior center where they play games once a week. Some of her roles include being a mother, grandmother, wife, friend, and sister. And her values, beliefs, and spirituality, like I said, she's very involved in her church, and that's something she's very passionate about. Her routine is the same every morning. She wakes up, takes her medicine, waits for it to kick in before she gets up, makes her and her husband coffee, and then they watch Good Morning America together. And she soaks her feet during that because that is what the doctor ordered. Okay, so for the first article I found, it was called Effectiveness of Occupational Therapy, Interventions for Lower Extremity Musculoskeletal Disorders. And the main one it focused on was arthritis. So osteoarthritis can be treated and should be treated with milder therapies for older populations. More vigorous therapies can actually be damaging. So an example I thought of was aquatic therapy. And some of the benefits are increased joint movement and socialization. It would get her into the community and have her meet people that are suffering from similar things she is. And this link is just classes that are near her home that she could attend. And then the second article is called Occupational Therapy and the Person with Diabetes and Vision Impairment. And this article just talked about the link between diabetes and other health problems like vision impairment. And she did tell me that her vision impairment came after her diabetes diagnosis, showing that those two are connected. It also talked a lot about educating your client on their diseases. Educational classes are important to teach how to manage your disease, whatever it might be. So this link is just shows the classes for diabetes that are near her house. So overall, I've learned so much new information. I've learned how effective and accurate a profile must be for the treatment plan. I also learned that patients confide in you. My short interview with her, I felt like I actually helped and that she could trust me, and I really liked that part of it. And I also learned that there's so many new subjects in OT, like diabetes. I never would have thought that was under the scope of practice, but it is, and you just have to know your client. And the field is even larger than I imagined, which makes it that much more appealing. So thank you for listening, and here are some of my references.